Hello guys, welcome back to my YouTube channel and welcome yet to another series of what is inside the antenatal booklet. And today we are going to talk about the medical and surgical history of our mother. Have you ever asked yourself, why do midwives always ask a lot of questions concerning your health, concerning your previous health, concerning your previous surgical history? Have you ever asked, does that information bring any importance to the current pregnancy? Have you ever asked yourself, why do we always ask all those medical questions, whether you have hypertension, whether you have diabetes, whether you have ever undergone a certain surgery? Have you ever asked yourself, is that this information really important in this current pregnancy? This is what we are going to talk about. So stay tuned. If you have not subscribed, kindly hit that subscription button and let's learn together. So, guys, on our antenatal booklet, the one that I am having, the first history, that is in the medical surgical history, we ask you about the surgical operation. Have you ever undergone any surgical operation? Okay, and not only surgical operation, we also ask for just any operation in your body, whether it is a surgical operation or it is a gynecological operation, because we have the surgical operations. Let's say like you had hernia and you are undergoing a surgery to remove the hernia. Let's say you had an accident, you had a fracture in your maybe in your legs or your hands, then you underwent a surgery just to make sure that you get we call it ORIF or ORF, some fixation of maybe what people say you have a metal inside your body, just to fix the fracture and all that. So we ask for any surgery, basically because we want to know what happened in that surgery. Did you have any complications during the procedure? In theater, did you undergo any complications with the anesthesia? Did you undergo any bleeding complications and all that? And also, as a woman, we have to ask you, have you ever undergone any cesarean section before? We want to know, did you have any delivery before through a surgery, through the cesarean section? Because we want to know whether we are waiting for a normal delivery in this current pregnancy, or maybe we are going to plan for an elective CS for you. So we have to ask about that, and those are the reasons why we need to. And in case you had undergone a previous cesarean section, we also need to ask you, do you know the reason as to why you are taken in theater for theater for cesarean section? We need to ask because we have some reasons which might also reoccur in a current pregnancy that could take you also to theater again. So we also need to know what was the reason for you to undergo cesarean section, and I shall do a video exclusively explaining why a mom had gone for a cesarean section and then maybe came to deliver normally after, because other people will wonder, why did I have to go for a CS for the first pregnancy, then probably the second pregnancy I have delivered normal? This is because doesn't mean that you went to theater just because your pelvis was not adequate. But in case the reason was the pelvis was not adequate, it definitely means that that pelvis is created like that and it will never be adequate for any delivery. Meaning this type of a mother will forever undergo a cesarean section in all her deliveries. But if it was any other reason apart from that, it definitely means that probably the mom can also deliver normally after. So second thing that is being asked, remember guys, I am following the antenatal booklet because most of us women, we never have time to go through this. That is why I am using this, okay? The second thing that is asked here is any history of diabetes. Do you have a history, you yourself, have you ever suffered from diabetes? And do you have a family history of diabetes? Why do we ask this question? Because in case you have ever had an issue of diabetes, it probably means that pregnancy can worsen the situation, or we need to take special care for you during pregnancy so that you can be able to take care of your unborn baby and make sure that your unborn baby will be stabilized inside there. Remember, diabetes is dealing with glucose balance in your body and glucose processing in your body. So we have to make sure that your baby at least is stable enough. And also diabetes has other effects, like a lot of moms who have diabetes end up delivering very big babies. So also, us knowing that you have diabetes, we are expecting that you might deliver a baby who is a bit with more kgs than a normal baby. So that is also one thing that we need to know, so that we will know whether we are waiting to do a normal delivery or a cesarean section. Also, we also need to make sure that you are following your medication as a diabetic mom, so that your sugars will be well regulated. And when we know this, we are very ready. When we are delivering you, we are very ready to be able to take care of the baby's blood glucose. We have to check the baby's blood glucose. We have to make sure that if the glucose is low, we have to make sure that we are feeding your baby at a very and at very nearer interval, so that your baby doesn't go to a low blood glucose. I will also do a video on that. Kindly remind me always in the comment section. Okay. Another reason why we ask whether you have a family history of diabetes. This is basically because diabetes can be hereditary. You can inherit diabetes from your parents or even from your grandparents. You have realized that where the family lineage that has diabetes, almost in every generation, there must be, if not two or three, at least there must be one person who will suffer from the same illness. And in case you have never suffered from diabetes, but you have a family history of diabetes, there is a probability that the pregnancy will predispose you into getting gestational diabetes. Gestational diabetes is diabetes that has been brought by pregnancy. So there are those people who get gestational diabetes even if they don't have a history of diabetes. And there are those people who are born in a family lineage which has diabetes, so they have that element of diabetes in them, okay, only that they have never suffered from it. Then here they are, they get pregnant, and then that pregnancy now predisposes them to getting the diabetes. Another thing that is asked here is, have you ever suffered from hypertension? Have you ever had issues with your blood pressure? Or do you have any family history of hypertension? This is the same as diabetes. The explanation is the same, okay? If you have ever suffered from high blood pressure, it basically means that you getting pregnant is already predisposing you to getting the pressure going higher and higher, okay, because of so many changes in your body, changes in your blood pumping, changes in your heart, changes in the whole of cardiovascular system in your body, okay. And also, do you have any family history of hypertension? The reason is the same as whatever I have explained in diabetes. In case you have a family history of hypertension, probably now, in case you have also never suffered from that, probably now this pregnancy is going to predispose you into getting the hypertension, okay. That is why we need to ask these questions. And remember also, with hypertension, it is quite dangerous. We need to make sure that we get you closer to us, we get you closer to be monitoring your blood pressure, and also following up with your medication, because high blood pressure can really affect a pregnancy. There is a condition we call pre-eclampsia and also eclampsia. I will also do a video on that, so stay tuned, guys, because this is something that is so much common, and it is really an issue in a pregnancy, and a lot of moms have really ended up even in ICU when pregnant, just basically because of high blood pressure or hypertension. Whether it is gestational hypertension, whether it is due to family history of hypertension, or whether it is because you have always been suffering from hypertension. So stay tuned so that when I present that video, you will be there to learn that and to have a clear information about that. Okay. So another question that is asked is, do you have any history of tuberculosis? This is TB. Have you ever suffered from TB? The reason why we asked about this is, one reason is TB is something that takes the immune system so down, okay? We need to ask, in case you have ever had TB, was it fully treated? Because we have a whole regime of treatment of TB. We have a whole cycle, different cycles. So we need to know, were you really treated fully of the TB? And we have to retest it. In case you have a history of TB, even if you had medication but you are not sure whether you finished the regime, we have to retest the TB. Also remember, we want to make sure that we give you treatment. If it turns positive, we treat you fully before you deliver your baby, so that your baby will not be born when he or she has already low immunity due to that. Also, we need to ask, do you have any family history of TB? Because maybe your mom, your parent, one of your parents has TB and you are living with them. Remember, that is one disposing factor. If you're living with someone who has TB in your area, in your family, maybe your husband, your sister, your brother has TB, and you're there, you're pregnant, you're living with them, you can easily acquire that TB. So we need to know that history so that we can be able to advise you on what to do when you're pregnant, so that you protect yourself from acquiring this infection. We should also know this so that we will be able to prepare you on how you will be able to take care of your baby, on how we will start your baby on medication, as you also be testing your baby for the same after the baby is born. Okay, so that is also so much important to know. In case you have ever had TB, we retest it, we make sure that it is negative and all that. We'll be able to advise you on the predisposing factor of TB and everything. And remember, guys, I don't know of other countries, but what I know is we have vaccine that we call the BCG. BCG basically is a vaccine that is given during the immunization schedules of the newborns. We give it immediately the baby is born, so that we be able to give this baby an active immunity or an immunity against TB. In case this baby is delivered, and maybe during when the baby is growing up, maybe the baby lives around someone who has tuberculosis, at least we give this baby an immunity to prevent him or her from acquiring TB. Okay. Another thing we ask is blood transfusion. Have you ever gotten any blood? Like, have you ever been transfused any blood? And why should we be asking about this? Because there is definitely a reason as to why someone was giving you blood. There is definitely a reason why you were being transfused blood. It means you had anemia. Anemia is less blood or less HB in your body. And in case there is one time when you are not pregnant and you had anemia, then you being pregnant, remember, all the nutrients that you have, all the nutrients that your body has, is sharing with your unborn baby. Meaning already the less iron that you have in your body probably will go to the baby, and now your body now remains deficit again. So we need to know, in case you had anemia before, you even went to an extent of acquiring or being transfused blood, we need to know so that we get ready. We check your HB, and we keep checking your HB during pregnancy, because we always give advice that it is best for a mother to deliver when the HB is 12 and above. Okay, so we need to make sure that we are retesting your HB so that we give you a hematinics. Hematinics are medication that will help you increase that HB. Also, we'll give you some dietary advice on what to feed on, so that we make sure that by the time we are reaching term, you are already having a good HB level. Another thing we ask for, which is very important, guys, and a lot of people take it as a joke, is, do you have any drug allergies, or do you have any other allergies? And specify. If it is a drug allergy, there is a certain medication that you had ever taken and then it reacted on you. You always need to know the name of this medication, because now that you're pregnant, we do not want you to be given, at one point, to be given a medication that you will react with, because also drug reaction can be fatal sometimes, like meaning it can lead to death. Okay, so we need to know, do you have any drug allergy? Most of the times we ask, do you have, are you allergic to sulfur? Because a lot of patients, or a lot of people, or a lot of bodies will react with sulfur. So when you tell us that there is this antibiotic that I was given, I reacted with it, then I was given this other antibiotic, I also reacted. You know, most of the antibiotics have sulfur, but we also have those that do not have sulfur in them. So we need to know, if you are reacting to sulfur, then we will indicate there in red. We will indicate in this page. You see, this is a box, so we have to indicate in red no or yes. Okay, if it is yes, we have to indicate in capital letters and in red pen yes, and specify sulfur, so that any other person, any other health personnel, doctor, nurses, wherever you go and you give them this book, they basically know which page to go and look for. So they want to give you medication, they don't know you, maybe you just walked in a hospital, they have to check there. Okay, and they will see there is a history of this drug allergy, so that they don't give you that drug allergy. There are those people who are allergic to other things. Okay, there is also somewhere you write, so if it is drug allergy, we specify, or other means any other allergies, because there are those people who are allergic to white meat, others are allergic to red meat. It's good also, because probably we are going to admit you in our hospital, so we need to know also whether you are allergic to a certain type of diet. Okay, so that we don't give you that. So it is good that you get to tell us that. Then the last history that we ask, okay, which is fun. Now this one, almost everyone smiles when we ask them about that, is family history of twins. Do you have any history of twins? If you have ever delivered twins, you say yes or no. Do you have any family history? Like, what do we mean by that? Has your parent ever given birth to twins? Has any of your brothers or any of your sisters given birth to twins? Then you can tell us that. The reason, definitely, we all know that in case your family lineage has ever had twins, it definitely means that you are also most probably carrying the genes of twins. So if you have not yet delivered twins, probably there is a probability that you have that genes in you, and maybe you might be carrying this pregnancy. Okay, so basically that is all about the medical and surgical history, and all this history is so much important, guys. And now I guess you have now understood the weight and the reason as to why we need to ask these questions. Okay, so we will continue to learn together. This book, that is why this book is so much important. I guess by now, by this video now, you have already understood how important this book is. So stay tuned, guys. Subscribe, like, comment, share, and also tell me which other thing do you want me to talk about in the next video. Comment it in the comment section and let's learn together. So until our next video, it's a bye bye for now.